Okay, Brother Lewis, I just wanted to demonstrate for you and for our vast audience, one of the things that's very helpful to do is use, especially Bragg's because it's organic and they've been doing it for 110, 12, 14 years, vinegar and water. And I sit on an empty stomach and I can verify that I have only oatmeal, so I have an empty stomach right now. So I'm going to use the 8 ounces of water. And I'm going to see if I can get it in there, but would you hold that up for me? Yeah. Hold it up high, yeah. Okay, right up the top. Yeah, there you go. Alright. That's my 8 ounces of water. Unfortunately, what they did, they had this one filled, I mean, they really give you your money worth on this because this is filled over the top. And 2 tablespoons of apple cider vinegar. And the question was, does this get old? The only thing you really need to do is shake it up. And then, even if it's a very new bottle, shake it up so that all the elements in vinegar is used. And they use 2 tablespoons of vinegar. You take this on an empty stomach, and what it does, simply, it helps keeps your acid alkaline level where it should be. Now she brought me 2 glasses, and actually she had an 8 ounce glass, so I'm just going to use the glass and enjoy. I did that for 2 reasons today. Number one, I needed to do it because I was having some dry coughs and I had to blow my nose a bit. So that's one of the reasons. And it does help. It's very helpful. You do this 2, 3 times a day, but preferably on an empty stomach. And that would be in the mornings, and if you after lunch sometime, and then later before or after your lunch in the evening. One thing I wanted to discuss real quickly, and that is, as we mentioned, we talked about 100 different types of body cancers. We only focus on prostate, but there's so many others that we can actually focus on, and perhaps the next time we can take another. I'll give you, for many men, a little secret. Breast cancer. It is not strictly due to is a women issue. Men can contact breast cancer. The reason I know, a neighbor of mine had breast cancer. He was treated, he was cleared, and he introduced me to the person who is my mentor today, Brother Franco Taylor, who is a master herbalist. He's been all over the United States teaching and giving information on health issues. Now, we do know this. Every 11 months you get an entirely new blood system, a blood stream. So it's not the blood that gets old. Every 11 months, every cell in your body has renewed itself. So you are practically a new body in 11 months. Every 2 years, you get an entirely new bone structure. So in 3 years, you're really born again in the physical. You can only do this by what you eat, the foods you put in your body. To do it properly, you can eat you get the hamburgers, hot dogs, and sodas and 7-Ups, but they will not do the job that this should do in treating your body. And why the bones get weak? You don't feed the bones. Why the prostate have a problem? You don't feed it. All these elements have to be fed in the body. And people eat because of what it tastes like, what it smells like, because you like it. And it's junk food. You cannot put junk food in a live body and expect that that's going to do the job for you. Now, I just want to look at a few things here. The Whole Body Research Support Group sent this information. They talk about the brain cancer, breast cancer, blood cancer, lung cancer, skin cancer, pancreatic cancer, prostate, and colorectal cancer. That's just a few. They said there's 100. And when they say that, they're talking about cancer from your head to your toes. And they give it a name because of where it's located. So Brother Lewis is going to ask one or two quick questions here. And we're going to look at what the whole body research support group says.
Yes, one of my first questions, what can you tell us about brain cancer?
Well, today, what they say, only 1 in 3 patients survive longer than 5 years after an initial diagnosis. But with the help, scientists are testing more effective therapies and improving their dismal dismissal rate.
Questions about lung cancer. Lung cancer is due to what?
Well, smoking is one. That's one of the biggest things they talk about. The environment, and of course, not eating proper foods. It's all going to come down to what you eat, drink, put in your system, the vitamin D, the sunshine you get on your body. Now, this says this: lung cancer accounts for about 1/3 of all U.S. cancer deaths each year. But your support is helping the NFCR scientists find more effective strategies for preventing, diagnosing, and treating the #1 cancer killer. But I still say, regardless of what those doctors do, they cannot beat the great physician. That's God, who created the universe, who put everything in the universe for us to use, to take care of the body, to feed the body. You can't beat that. Next question.
Yes, pancreatic cancer, is it cause or have anything to do with food and bad environments?
Well, look, all cancers has to do something with food. There's no way around that. And as Hippocrates said this, but remember, this was said from the beginning. Not Hippocrates, he's talking just 2,040 years or so. But from the very beginning, God set the parameter. Now, they said the 5-year parameter of survival rate for all stages of pancreatic cancer is only about 6% in the U.S. Now, and they ask for support. And every one of these answers they give us, they're asking for support. Your generous support makes it possible to find the approach.
What different types of blood cancer are there?
Now, the types of blood cancer, we're talking about leukemia, and these are the kinds of things that, I'm sure there's a number of things that is not listed here. But when you have a lymph problem, you got a serious problem because your lymph nodes have transferred the fluids in the body. And it says, they constantly here they're asking for your help for research. But I still go back to eating the foods God intended for us to eat. That is a vegetable diet, fruit, nuts, grains, and he said it in his words that he is every tree he's given us for herbs, for food, for us all over. And that's if we try to get around that, that's where the problems come in. And of course, the environment. All these things has a big effect on us today. I want to take this very last minute to thank you, Brother Lewis, for coming in today to help discuss this issue on prostate cancer. Maybe in the near future we will come back to one of the other 100 or 99 that's left out there that we didn't talk about today. But I was interested in men because women have a better record of thing about talking about problems and health and sharing. Most of than men do for some reason. I guess it could be a brain thing. But I want to thank you for helping me to get this information out. And we hope that men will take notice of this and get into groups. Do some reading, do some studying, go to your YouTube and find these things out in advance. Don't wait until it happens, because most times then that is too late because you have let it advance too much in your system. So thank you very much, and